Thank you for joining us for this blood cancer video library as part of GRACE. And I'm always happy to collaborate with GRACE, and this is one of the few series that I've been privileged to do. So this is essentially meant to be a patient primer and an overview of the blood cancer disease called AL amyloidosis and the management of AL amyloidosis in 2024. What does that look like? For a brief introduction, my name is Dr. Sridevi Rajeeve. I'm an assistant attending and with the multiple myeloma and cell therapy service at the Memorial Sloan Kettering Cancer Center in New York City. So we can dive right into what exactly is amyloidosis. Amyloidosis is a generic term for a disease state that occurs when there is a deposition of abnormal proteins outside of cells and into various organs and tissues. On the right side, you see like a high level, macro level DNA-like image of a protein and how a fibrillar amyloid protein looks like. So when you see all these abnormal proteins that are being deposited into organs and tissues where they actually should not be, right? These abnormal proteins should not be present in the blood in excess amounts, and B, when present in excess amounts, they should not deposit into vital organs and tissues. So when that disease state happens, that is called amyloidosis. Now, just to go into a little bit deeper into what exactly are these proteins composed of, these are proteins in a fibrillar form, as you can see on the image on the right, and they're composed of very low molecular weight subunits of a variety of proteins that circulate in the plasma. These proteins are actually derived from soluble precursor proteins, meaning a protein stage one step earlier, that undergo a shape or a conformational change that leads to the adoption of a predominantly what we call an antiparallel beta-plated sheet of configuration. What it really means is that when the protein goes into this antiparallel beta-plated sheet of configuration, it's really easy for the protein to deposit, and it's very hard for the body to eliminate it from the system. Now, there are many forms of amyloidosis that are increasingly being identified in the world, but I've listed the four major forms of amyloidosis that we always try to make sure that which exactly is the type of amyloidosis that the patient has. The four major forms include AL amyloidosis. Then there's something called as ATTR or transthyretin amyloidosis. Then there's something called AAA, AA amyloidosis. And another common amyloidosis recently has been dialysis-related amyloidosis. So going into a few more details about what are the types of amyloidosis, AL, which is going to be the focus of this talk, AL amyloidosis is due to the deposition of a protein derived from immunoglobulin light chain fragments. And this is a potential complication of any plasma cell disorders such as multiple myeloma, monoclonal gammopathy of undetermined significance, Waldenstrom's macroglobulinemia, etc. These are plasma cell disorders that eventually result in an overproduction of antibodies. So if you follow my laser pointer here, this is a pictorial depiction of a plasma cell, and when there is overproduction of immunoglobulin light chains, these form the fibrils of the amyloid protein and cause this disease condition called AL amyloidosis. Now, the other type of amyloidosis, which I discussed before, the AAA, is called AA amyloidosis. It's usually common in patients who may have chronic inflammation, such as those patients who have chronic autoimmune diseases. And it's mostly seen in resource-limited countries where you have chronic inflammation due to chronic infections, undiagnosed autoimmune diseases, etc. So anytime in the body there is chronic inflammation, it activates the macrophages in the body, and they secrete an abundance of interleukin 1 and 6, which act on the liver cells to produce this serum AA protein. And this AA protein goes and deposits in various parts of the body, causing this AA type of amyloidosis. The other type of amyloidosis that we talked about was the transthyretin amyloidosis, or ATTR. ATTR can be either due to acquired mutations that is passed along in families, and that is called familial amyloidosis, and it can manifest in the form of a polyneuropathy syndrome called as familial amyloid polyneuropathy, or it can be in a form of a cardiac disease called familial amyloid cardiomyopathy. It can also occur in a non-inherited or non-family or non-familial form. As we all age, we tend to acquire mutations because of aging and not really because of what we inherited from our parents. And that is called a wild type ATTR amyloidosis. And lastly, those patients on dialysis tend to generate some amyloidogenic protein, which go and deposit in other organs and also are found to have amyloidosis. So our focus of today's talk will be on AL amyloidosis. So this is another table that summarizes the different types of amyloidosis that we went in detail before. As you can see, there's more than the four that I discussed. And a lot of the times, amyloidosis can be systemic, meaning it affects a lot of the parts of the body and not really localized anymore. The inheritance of this kind of diseases can be hereditary in some forms, like the hereditary AL amyloidosis, which is extremely rare, but also the hereditary ATTR transthyretin amyloidosis. There are also some amyloidosis, such as the AA or APOAI amyloidosis and the amyloidosis associated with atrial fibrillation that are inherited. But for the vast majority of patients, these are not conditions that are heritable. It predominantly affects the major organs such as heart, liver, kidney, nervous system, and GI tract. And across different types of amyloidosis, there is a slight predominance to different types of organ systems as well.